Thank you very much, Mr. Chairman, and of course we welcome Secretary Burwell. Before I go to my questions to her, Mr. Chairman, I'd like to bring to your attention and the committee's attention that a very dedicated staff member of this committee for 13 years, who has worked for Senator Harkin, then worked for me, was also respected by Senator Specter, will be leaving. Adrienne Hallett, who's worked for the committee for 13 years, will be leaving to go to the executive branch. Actually, she's leaving to go to NIH, not for a clinical trial, but to, again, help Dr. Collins. So I would like the committee, really, if we could, to give Adrienne a round of applause.
And I will say thank you. Thank you to the committee.
Madam Secretary, of course, I'm glad to see you. So many of the great federal assets of HHS is in Maryland: NIH, FDA, CMS, just to name the big three. And they have a tremendous impact on our economy, the jobs they provide and the jobs they stimulate. We could not have the robust biotech community we have in Maryland without you. And so we'll, of course, be talking about those issues, but I'm going to go right to a Maryland issue in a part of the state that's very familiar to you, my mountain counties up in Appalachia. I have a situation where, due to the census, they're telling me that Allegheny County, right next to our colleagues in West Virginia, you're a daughter of West Virginia, has lost their designation for federal funding to qualify for the Affordable Care. I wrote you a letter in February. Your staff has been calling back and forth, but we've been told recently there is nothing you can do. Madam Secretary, I need you to look into this. You know Western Maryland. You know those mountain counties. You know they've lost population. You know that they've lost jobs. We don't want them to lose hope in their government. What the loss will impact is $2 million. That might not be a lot by our spending up here, but that enabled them to attract doctors. It enabled them to harness volunteers like Mercy that reduced dental visits. Could I have your assurance that you will actually look into this and not just have a lot of bureaucratic phone calls back and forth where they just say no?
Senator, I will look into it and see what the opportunities are for us to try and support this county.
And not just a list of grants that they can apply for. They are not an urban county. No. So let me go on, though, to another issue, which really, though, was a source of, I think, great exuberance among many of us. The fact that we worked together on a bipartisan basis to pass the Child Care Development Block Grant, working so closely with Senators Alexander and Burr, Senator Harkin, and myself. Could you tell us what now, because we pass an authorization, what you're doing to implement it, and particularly where we work so hard on the quality provisions? Sure, we wanted more money. Sure, we wanted more slots, but we really focused on a bipartisan basis. Could you tell us what's in the money to implement the law and then enhance the quality and safety of our children?
So the quality and safety are a large part of the implementation and what the money is for, and that is actually implementing the standards that you all put in with regard to increasing the questions of safety and quality on an evidence base. And so that implementation is part of the money. The second part of the money, the only other part of the money that is in there in terms of this implementation, and thank you all for your leadership on this, is there are funds, because one of the other things that we were asked to do is to make sure that childcare for unusual circumstances, for parents who work different hours, for places that are not receiving and hard to reach, that we do work in that space to understand how we can help and support that. So quality in terms of the standards, and those were standards that we need to apply and implement, and we will do that, as well as the quality issues. And this cuts across the entire suite as one looks at the continuum for children. Home visiting, child care in terms of implementing the authorization that you gave us. Also in the budget is the child care expansion that Senator Murray mentioned, the $8.82 billion over the 10-year period that would be for making sure that working families have access to that. And then we don't want to forget Head Start and Early Head Start and those partnerships. So this is a continuum. We will work to implement that piece in the context of improving quality and safety across all of those pieces.
But in a nutshell, it's $370 million increase from last year. Is that correct?
That is correct.
And of that 370 million, about 270 million is for the new quality provision.
That's correct.
Do you feel that's adequate?
We do, to get us started, and I think what we want to do is get the implementation started, and as we look at next year's budget, we will understand more.
And then you also have 100 million for pilot programs for this gap in care.
That's
And
right.
I say to my colleagues, when we think of shift work, the days of factories are one thing, but for example, we have nurses who are working the night shift. I have the National Security Agency that works 24/7. Many are women who are cryptographers keeping America safe, often single mothers. So I think we're on the right track. And I also hope at another my time is up, but that we could have additional conversation on the work that you're doing on both foster care and also on the unaccompanied children. Though the children seem to not be at the border the way they are in our country. They could continue to come. We cannot turn away from this very important issue. So I look forward to dialogue with you and with the chairman and the ranking member.